The issue is, was, that I was having numbness in my right side of my body, my arm and my leg, tingling, and then it goes numb, and then it goes weak when I was asleep. This went along for about 4 years or so. So I went over and I got some examinations done. 2 years ago, I was told that I had a problem in my spine, but nothing was done. I was given some painkillers, and it kept me numb, so I couldn't feel the pain, but it was just temporary. So then after I decided to go and research what was good for me, I went and looked at this well-renowned hospital. I went and I was interviewed by a doctor to see what the situation was. I wasn't satisfied with that, his opinion, and then continued researching as to what will be the best path for me to get better. And I stumbled into basic. I saw Dr. Patel, and again, I'm a very picky patient, and I take my health very, very serious. And the first thing that he said is like, okay, so I think this is what you have. I brought them over paperwork of previous tests, and I said, okay, we can fix this. I'm gonna go ahead and take some other tests, and then we're gonna go from there.
I decided to pursue a MRI of her cervical spine and her lumbar spine, and we were able to correlate the findings on the MRI. This gave me great confidence that the symptoms she was having could be treated. We decided, like always, to start with the most conservative measures. We performed diagnostic and therapeutic injections, and she received tremendous relief from these. I was therefore very confident that the symptoms she had were coming from the disc bulges and herniations in her neck and her low back. She did receive great relief from these injections, but like most patients, the impact of the injections was temporary. When her symptoms recurred, I gave her the option of pursuing surgery. I talked to her at length about the risks and benefits and the minimally invasive options we can offer here at Basic. After discussing with Esmeralda, she decided to pursue the surgical option. She had lived with pain long enough and wanted the final definitive solution. The surgery that I recommended for her was a minimally invasive discectomy and foraminotomy. This is a procedure that's performed through microincisions, where we remove any herniated discs and create room for the nerves that are currently being squeezed, creating sciatica-like pain.
My surgery was, to my surprise again, you hear all these horror stories everywhere, and then I said, to me it just was easy in my mind when I went and I approached the staff. I got there in the morning. I was prepared for the surgery. I had other staff meeting me and making sure that I was comfortable with the situation, and actually calming me down because I was scared. I have to be honest, I was scared, but it was easy.
In the case of Esmeralda, she had a herniation at the L5-S1 level. As a result, she had persistent pain shooting down her leg. Some people will refer to it as sciatica. The pain did not get better with time, physical therapy, and only temporarily improved with injections. The reason the surgery was pursued was because of the persistence of symptoms. This surgery involves making a small incision over the low back and creating a window through which the disc can be removed. In addition, we also perform a foraminotomy. A foraminotomy is a procedure when we increase the space available for the nerve root to exit. All of these will remove the pressure on the nerve and lead to pain relief.
After the surgery, everything went well, thank God. I went home, and to my surprise again, Dr. Patel was calling me the same day and the next day to see what I was doing. Another surprise is that as soon as I walked out of the surgery room, or was released from the office, I didn't have the pain that I had before I came into the surgery for. That pain was gone. And then I kept on thinking maybe it's just the anesthesia. Maybe because they gave me painkillers is that I don't have the pain. But the day after, I didn't feel the pain. Actually, I went to sleep very well. I didn't have any problems as far as the pain. And the pain wasn't there. So to me, it was foreign because I had the pain for so long and I didn't have it. And the next day, I didn't have it. And the day after, I just had that, the pain from the incision but not the pain that I came for. That was gone the very next moment after the surgery. And I get teary because it's not that I miss the pain, because I don't miss it at all, but I never thought that I will feel how I feel now. I can sleep at night. So to say so, it is, what can I tell you? I'm ready the next day to do what I need to do to take care of, the many things that we as parents do. Mothers, we, neglect ourselves for so long, and then we go through the pain. And, now knowing that I could have resolved this 2 years ago, and then keep on going and moving forward stronger with my family and taking care of the kids and doing what I need to do at work, and being able to hang around at home a little longer and being awake and, not moody, not grouchy with the kids or with the husband. That makes a difference. So my life is changed for the better 1,000 times.